Thank you very much. Once again, it's a great pleasure to be here, to see a lot of old and new friends and share in this great experience. I have no proprietary interest to the material presented here. My case is that of an 84-year-old woman who had bilateral pseudophakia, no really eye complaints except her vision was 20/50 in the left eye. Her pressure was normal, and she had some mucoid discharge in the left eye, and she was referred, referring doctor suspected this was an orbital tumor. Here's the appearance of what she looked like in the lower fornix. You can all see this diffuse pigmented lesion appearing there. And when we lowered the eyelid, it was even more apparent. The differential diagnosis, therefore, of a conjunctival orbital mass comes up. At this point, we're not going to get a response, I know, but it would be nice to hear comments as to what this could be. This looks like a melanoma. But what is the origin of that melanoma? Does it come from the conjunctiva? How many people think it's conjunctiva? Okay, how many people think it's from the orbit? How many people think it's from the uvea? And skin melanoma? And how many people don't care? 100%. So thank you. But we'll go on. She did have an orbital mass, and if you look here, you can see in the orbit this mass going back to the orbital apex from the globe. I'm not going to try to use the pointer because it'll lead to trouble. So there was a hazy view of the fundus in this patient, and we didn't know what this was, so we started taking the history from the patient, and suddenly she reached into her purse and she pulled out a test tube from her purse that she had kept as a souvenir for 25 years. How many people think they know what it is now? Any hands? And in that purse was the clue to the diagnosis of the orbital mass. Who knows what evil lurks in the test tube I'm showing you now? Anybody have any ideas what the diagnosis could be? Well, her test tube in her purse said Mirogel, M-I-R-O-G-E-L. So what could that be? The orbital mass was composed of Mirogel. How many people think they know what this is? Quite a few hands go up now. Good. So who can tell what history was I withholding and not telling you the important thing in her history? Yeah. She had a history of retinal detachment surgery. And you can see the rhegmatogenous detachment here quite nicely. That's not her case, but a similar one. And this was a case of Mirogel orbitopathy after scleral buckling procedure for a retinal detachment. The Mirogel implant was introduced in the 1980s by the Mirogel company in Boston. It was a flexible implant designed to swell and to close the retinal hole and to improve the effect of the scleral buckle. And it was sold very widely in the United States and in other countries. The Mirogel implant. Although it was hailed as a great thing to have and cured retinal detachment surgery, in the long run, the implant began to migrate in many cases. And sometimes this migrated implant took on the appearance of a melanoma of the conjunctiva, the orbit, or the eyelid, and they were very difficult to remove. And they became very unpopular as these noted complications, and there were quite a few reports in the literature of complications. We came across 23 reports in PubMed when we put this together, and most of them were case reports. Ultimately, we found a series of 4 that came to Wills Eye Hospital, and Carol and our team wrote them up as expanding Myrogel implant, scleral buckle, simulating an orbital tumor in 4 cases. So I'd like to share with you rapidly a couple of similar cases. One of the cases of the series is shown here, where you can see in the left eye that abnormality, and there was a orbital mass suspected and seen on imaging studies. One can see in that case that the involved eye was totally surrounded by this hyper-intense mass, which was thought to be a possible melanoma at the time. Another patient was 75 years old and came in with an orbital mass, and she was worried about a melanoma, and she was sent to us to have an orbital exenteration, and that's what it looked like. The referring diagnosis was malignant melanoma, and it was pigmented, as you can see. But we showed that asked this patient 2 questions. Anybody know the questions? The first question was, are you from Boston? What does that have to do with anything? Well, that's where the Myrogel company was sold, in Boston, in Massachusetts. And the other question is, have you ever had a retinal detachment? And the answer to both of those questions was yes. She had a retinal detachment, and she lived in Boston, which was an interesting response. So it shows 3 other quick cases. One sent in with a diagnosis of orbital tumor. Another one has pigmentation that looks like acquired melanosis, and was referred in also as an orbital mass. And another one, 38 years old, had a pigmented orbital mass. And all of these were expanding Myrogel implants. The surgeons who dealt with these had great difficulty, we included, in removing these. It's improved in recent years, but it's very tedious, friable surgery. It should be complete, but very difficult. Cryotherapy and other methods have been used, and suggested open 4 quadrants of the conjunctiva and remove them by cryo-extraction. And there's a number of other approaches to treatment that are more controversial and unpredictable. So in summary, I've showed you here a patient with an orbital mass that was suggestive of a melanoma. It proved to be a possible extraocular extension of a uveal melanoma, but her surgery revealed that, the history revealed that she had a prior buckle for rhegmatogenous retinal detachment. And this has been familiarize you with this particular implant and provide you with a short review of the literature. I think these have been confused with orbital masses, conjunctival masses, extraocular extension of uveal melanoma, and it's very important that surgeons that do this kind of surgery should be familiar with it. Thank you.
How many in the audience have seen cases of this, Myrogel orbital tumors? There's a few, maybe 3 or 4 people have seen this. Yeah, Jerry, you emphasize the difficulty in removing. Your best approach is not to touch it, you know? But if you have to, you want to completely remove the capsule that envelops it, and then you can't pull it out because your forceps will go right through it. So you have to get like a fissure retractor or something to push it out from behind.
Okay, thank you.
Thank you. So the next